Hi, this is Dr. Nina Naidu. I'm a board-certified plastic surgeon in New York City, and today we're going to talk about the profile of implants. So what do I mean by the profile? I'm talking about not just the width of the implant in centimeters, but also its height from the chest wall. That is, how much does it project up from the chest wall? And you can see that from the side. How much does it stick out? That is, when you put it into the body, how much does it actually come out from the chest wall to give a patient the look of an augmentation? So this is a low profile implant. This particular implant, if I measure it across, is approximately 13.9 centimeters. And when we measure how far it comes up from the chest wall, it is about 3 centimeters. So it's a fairly wide implant. Now, what if I have a patient who has a more narrow chest wall but still likes this size, still likes this volume? The answer to that is a medium profile implant. And so this one, if we look at its measurements, is 12.3 centimeters. So it's more narrow. It'll fit into someone who's a bit more petite, but it still has the same volume. In terms of how much it comes up from the chest wall, when we measure like this, it's about 3.8 centimeters. So remember, the previous one was 3 centimeters, so this gives 0.8 centimeters more projection from the chest wall. So let's say I have a patient who's even smaller, even tinier, but she really loves the size, and the bigger sizes won't fit into her width. What do we use? We use a high profile implant. So as you can see, this one's even more narrow. This is 11.4 centimeters across. Remember, the first one was 13.9 centimeters and the second one was 12.3. This is 11.4 centimeters. And in terms of how much it sticks out, you can actually see without my even having to really turn it, it comes up quite a bit. This distance from here to here is 4.6 centimeters. So this is a high profile implant. So just to go back, this is a low profile, medium profile, and a high profile. Now, in my practice, the ones I most often use are the medium profile implants. In my opinion, which is just my opinion, these give the most natural look to the breast. So most of my patients coming in do ask for a very natural looking implant. Most of them don't want a very large implant. So it's very rare that someone in my practice would be a candidate for this. Most of my patients really want more of that natural medium style implant, which gives a really, really nice, gentle look to the breast. The low profile implant, I'll confess, I have almost never used. I can't really think of any cases recently where I've used them. These are relatively flat. They're wide and they're flat. So there are very few patients who are really going to go for that because it just doesn't fill out that much of the breast in terms of the anterior or posterior direction. It'll fill out the width of the breast if you have a larger chest wall, but it's not going to really give you much in terms of projection. So for the average cosmetic patient, this isn't the best choice. For a reconstructive patient, it may actually give them that fill that they need, but even then, in most of my reconstructive patients as well, a lot of times it's either the medium profile or the high profile. If you go onto the, this is medium, this is high. If you go onto the manufacturer's websites, you may see different descriptions of their implant styles depending on the manufacturer. So these are Mentor implants. Mentor calls them moderate, which is their low profile. Moderate plus is their medium profile, and high profile is their high profile. Until recently, Allergan was calling their implant style 10, which was their low profile, 15, which is their medium profile, and then 20, which was their high profile. They actually came out with styles 40 and 45, which are even higher profile and which were more for the reconstructive patient. Sientra is the third major manufacturer in the United States of breast implants. And similarly, they have different names. They have the same names of moderate profile and high profile. So those are the profiles of the implants. Which one is best for you is absolutely going to be dependent upon your measurements that are taken at the time of your consultation. So, as I said, if a patient has a breast that's this wide, this implant's going to fit fine. But if she's got a chest wall that's this wide, this style implant is not going to work, and she may need to switch over to the high profile if she really wants something to fit into her chest wall and she really likes that volume. So I hope this was helpful. If you have any more questions, please go to www.naiduplasticsurgery.com, and thanks for watching.